Hey, Dr. Isaac Jones here. Today what we're going to do is talk about what you need to know before using social media for your practice. Now, I know you're probably dabbling in social media, you've looked at it or you want to jump in, but a lot of the challenges that 21st century healthcare businesses make is that they're going about it all wrong. They're actually marketing and they're trying to create a strategy for driving patients into their businesses through social media primarily, and they don't have optimal conversions and they don't have the tail end built out so that they can actually capitalize on what they actually want to do. So we're going to get into some of the strategy. We're going to get into how not to make the mistakes that a lot of people I get on calls with, big health centers. I get on calls with stem cell medical offices. I get on calls with people that are in the hospital space, etc. So a lot of medical doctors and natural health practitioners. And every day, every week, I'm always kind of talking about different ways to transform the health of the people that they're working with, as well as how to market and access this 21st century model of healthcare and marketing and business. And so this is what we've done over the last 11 plus years, what we're really good at, and what we've helped so many people get to a very high level of success at. And so when I started my brick and mortar practice, social media was different in 2008, 2009. I mean, it was like, shooting fish in a bowl type thing. It was so easy. Your reach went out to so many people. And, if you post anything on Facebook nowadays, it's like maybe one out of 1,000 of your friends will actually see it, one of 100 of your friends. So the reach is like 1 or 2%, not that good. And whether people actually engage with the content is another thing. So that obviously is very challenging. That's something that we have to look at and open our eyes around, because we do live in a different age. And with people that are doing really well with social media, they didn't just start overnight. It's a long-term play. It's something that you need to kind of get good at over time. But what you need to do before you actually get into becoming, creating a system around social media is what we're going to talk about in this video. Advantages of social media are vast. It's a great way to get feedback on something that you're wanting to launch. It's a great way to connect and develop a conversation with the people that you're wanting to connect with. And it's a great free way to promote what you're wanting to do and what you're getting out there in the world, and in a way that's more conversational. So another good thing is that it keeps people up to date as to what you're doing. And it gives them access to, okay, this is what's new with Dr. Jones, or what they're doing with your family, etc. It's a platform to have a know, like, and trust factor go up, which is one of the essential elements of getting people to work with you over time. And again, it's a great way to generate new leads, new patients. Why can't you essentially just decide to do social media and pick your social media platform and just do that in a vacuum, essentially? And the problem is vast. I mean, there's a lot of different challenges when doctors do this. Is a lot of times you work with agencies or you hire somebody to do it for you. You don't know necessarily what you're doing. You're burning through a lot of cash and the results are just not very good. So it ends up not becoming very profitable because you don't have the right strategy, and you essentially are spinning your wheels trying to build something that doesn't actually return in a good way. But I want to get to really the 3 things that you should have in place before launching into social media. And I'm all about taking imperfect action, but if you focus on these 3 things before you actually launch into social media, what ends up happening is it creates a lot more momentum and it creates a lot more success in ultimately what you want to create. And this is what we've seen with so many of our clients and people that have built in our community over 1 million followers, 100,000 followers, etc., and really have a robust social media following that people love and connect with them and follow their brand at a high level. So the first is not a website. A lot of people are like, oh, I need to invest all this money into a website. It's actually a funnel. This is the gas pedal of a business. Funnels are the conversion points of a business. This is the gas pedal of a business. So, in a car, you obviously want to be able to move the car. You don't want to just build a car, you want to move the car, right? The gas pedal does that, and the engine does that, and the funnel is kind of the gas pedal or the engine behind the car to make it move. It drives revenue for the business forward. It's like the emails that you send, it's the opt-in page, it's the getting them to do what you want them to do. And a website oftentimes can become a distraction for you. It can be a money pit. And then if you don't know the right strategy around how to build your websites around your gas pedals, then it's also a big waste of time. So the first thing is your funnel. The second thing is the strategy around your social media, right? When I was talking to Ethan, the chief content officer at Dr. Axe, I said, if you could go back to the very beginning, what would you do for social media to really drive more people into draxe.com than you did over the years and even faster? And he said, we were just creating content to create content. And he goes, we didn't really have a strategy around it. We were just trying to create like SEO rich content. And one of the things that he said that has always stuck with me is he said, if I could go back, I would look at what's our gas pedal? What's the engine behind our business? And it would be certain products or certain digital educational programs for virtual practices. It would be like your signature program process that we talk about a lot inside of the Health Experts Alliance community. If you just do this, where you build a content strategy that is specifically driving people into your gas pedal, and you create multiple different ideas around content that you can create, and you're constantly creating content that drive people into that one thing versus content that doesn't lead necessarily anywhere, and you do that in a more consistent basis, etc., then you start creating a lot more momentum, a lot more traction. And you're adding value, you're adding value, you're adding value, and then you obviously ask them to take action on something. So that's what Gary Vaynerchuk calls the jab, jab, jab hook, right? So you're jabbing, 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 you're adding value, you're adding value, you're adding value, and then the hook is, I hate that analogy, by the way. It's like you're punching your customer in the face, but like Gary Vaynerchuk is hilarious. You end up like getting people to take action on your deal. The last thing is a sales process. So you've got your funnel in place, you've got your strategy and system around how you're gonna create the content, when you're gonna create the content, what you're gonna create the content to drive people into your offer. And then the last thing is you gotta have a really great sales process. Now, I'm gonna have a link to some other content around selling that we have in the Health Experts Alliance blog that I want you to watch and listen to, because there's some really important things that are essential around sales. And we don't sell the way that a lot of people think of sleazy kind of selling, right? We actually use what we call the Socratic method of commitment and getting people committed to their brighter future. And it's through asking powerful questions and then co-creating a future with them that includes them working with you. So that is a different model of selling, but it is the way that Health Experts Alliance has maximized conversions. We're getting like 70, 80, 90% conversions with our doctors. It's just amazing. And it's creating a lot of momentum in these businesses to scale and grow. So we want you to have a sales process. So in conclusion, don't put the cart before the horse, right? We want you to have a funnel. We want you to have the system and strategy down first and then get the sales process. Then you can really move into driving social media. And the last thing I'd say that's not even really included in my notes here is that you really want to pick the right platform, right? Because there's so many platforms now. There's Telegram, there's Gab, there's Parler, there's Twitter, there's Facebook, there's Instagram, there's TikTok. There's all these platforms that are growing so fast, and it is very exciting. And so understanding your niche market, check out the articles that we've put out on that, is very important. And then obviously taking action on getting people to actually move in a direction of working with you is absolutely critical as well. So I understand there's a lot to learn. This can be very simple. It can be very easy. In fact, I'll just tell you how I'm setting up my social media stuff. I just have somebody create some bullet points for me. It's off to the left of this screen here. And we meet one time a month, and it creates the content for the entire rest of the month. Then I just go and I hit the points that I need to hit, and then I'm adding the value to you that I want to add. Then I send the videos to an editor, right? You can find all these people on Upwork or some other places like that. And then you've got this new system where people are doing it for very inexpensive, for like pennies on the dollar in respect to what you could be doing and spending if you're trying to like hire the big agencies or hire people in-house that are doing this exclusively for you just to get started. And you've got contractors that are essentially taking it off your plate, and all you need to do is just jump in front of a camera. Now, what they do also is they transcribe this video, and then they put the transcription into a blog article, and they have an editor that goes through and builds the article. So definitely check out the article, because there's even more really great content in there, and there's some images that they'll have created for me. But that's it, that's me. I get together once a month for just an hour. All the rest of the content for the rest of the month or for the next month is done. I just need to sit down, shoot the videos, and I'm done, right? I upload the video onto like Vimeo, and then they download it, they edit it, and do all the other things. But it's very simple. So just know that this whole process can be simple. And I just want you to imagine a world where you have a system and a process around getting your message out on a regular basis to people, where you have people behind you that you don't have to do all the technical things. You do the things that you are good at, which is your knowledge, your expertise. You get that out to people. And then over time, you start building a tribe. This is a long-term play, social media, unless you want to throw a lot of money at it quickly to boost posts and to get more people to understand what you're up to. This is a long-term play. You need to be committed to this for a while. And over time, you're going to create awesome, awesome success. We've seen it with so many of our doctors, and it's something that I'm starting to do myself. I just haven't really prioritized it in the past. So hopefully this makes a lot of sense, and this has added a lot of value to you. If you know of anybody that could use this information, please send it along. Share this content with your fellow colleagues, and I look forward to adding more value to make life even easier for you in the future. Thanks so much.